So in this video, we're going to be discussing osteosarcomas. So sarcomas are fairly rare tumors as they only make about 1% of adult tumors and about 15% of pediatric tumors. Osteosarcomas initially involve the bone and then they go on to invade the soft tissue. Starts off as bone lysis causing a periosteal reaction. On X-ray, you may see a Codman's triangle. The new bone of the Codman's triangle is the reason for the periosteal lifting. As the tumor grows, it forms a pseudocapsule or a reactive zone, where you may find satellite lesions, skip lesions, or inflammatory cells. You can think of the tumor as the Earth, with the satellite lesions as your satellite, with not much in between them. This is unlike a benign process, where it forms a true capsule, where there is compacted cells. What's important to note is that sarcomas spread hematogenously, whilst carcinomas spread via the lymphatics. So the goal when working up these patients is to stage them. You can stage them systemically and locally. For local staging, one would do an X-ray and an MRI of the affected limb. The MRI will tell us if the extent of soft tissue involvement, how many compartments are involved, and as well as whether there has been neurovascular compromise. For systemic staging, one would do a bone scan and as well as a CT of the chest and a chest X-ray and a CT of the abdomen to exclude metastases. Bloods aren't that helpful. They're more helpful in a pre-operative setting for things like hemoglobin, and the ALP and the LDH, you expect them to be markedly raised just because of the increased bone turnover. So osteosarcomas are heterogeneous tumors. That is, they're all pretty different and respond differently to different treatments. The basic principles for management are neoadjuvant therapy, surgery, and adjuvant therapy. Neoadjuvant therapy is important to kill metastases, shrink the tumor, and as well as to improve the prognosis. Once neoadjuvant therapy has been administered, then the tumor is surgically resected and sent off for histology. From histology, you would then want to know the degree of necrosis. If there's been greater than 90% of necrosis, this indicates to us a much better prognosis and that neoadjuvant therapy has in fact worked. Therefore, the drug in which you use for your neoadjuvant therapy can be used as your adjuvant therapy drug. If there has been less than 9% necrosis, this suggests to us much poorer prognosis, and therefore an alternate drug has to be chosen as your adjuvant therapy. So in summary, we've talked about osteosarcomas and how they form, the basic workup for these tumors, and the basic management principles which include neoadjuvant therapy, surgery, and adjuvant therapy. I hope you found this video helpful. Please like and subscribe and leave a comment below.